Community health needs assessment is now required under the Affordable Care Act, but we've been doing community health needs assessments back into the 1980s, so we're kind of old hands at this. We've done a very good job over those many, many years in engaging the community. And for the 2016 assessment, we also had a focus on engaging our own internal population for the first time, which was actually quite successful.
One of the first things we did early in the process was to engage with our entire leadership team. So with more than 300 individuals that comprising our leadership group.
One, we asked them to rank needs, and they learned how hard it is to say whether food insecurity is worse than homelessness, and how do you rank them and how very, very difficult it is. And the other exercise we asked them to do was say, okay, your tables rank these as the top needs in the community. How could we as a hospital address these needs? And that led to very rich conversations.
And so we looked at ways to bring in more stakeholders from across the organization. From that work, there were 9 additional work groups that were created, one for each community health need that we were going to address in the implementation strategy. And we included people from across the organization, senior leaders, VPs, physicians, residents, medical students, directors, managers, supervisors, line staff, people who had a real interest in the topic that they chose. We also had patient and family advisors, and we had representatives from the Department of Health.
We committed to 3 meetings for the work groups. The first meeting was really designed as a brainstorming session. Each of the work group meetings were facilitated by one of our quality consultants. So our second meeting, we had a community breakfast. We really wanted the work group members that were generally mostly internal to the hospital. We really wanted them out meeting community stakeholders. So folks in the community that were really vested and working on the issues identified in the needs assessment. The third meeting really kind of brought everything together. So we reviewed the brainstorming session from the first meeting. We discussed the strategies identified at the community breakfast, and the work group really worked hard to develop their final recommendations to be included in our implementation strategy. Because we're such a large institution, it's hard for one department to work alone. So we really need to work with all the departments across the hospital because everyone has a place in this implementation strategy and improving the health of our community.